Welcome to ESC TV. My name is Elin from Linkoping in Sweden, and I'm at the ESC Congress in London, and I'm here with Paulo Fonseca from Portugal. And you're here to present your study on paravalvular regurgitation in TAVI patients. Could you please tell us the background to your study?
Yes, thank you, Elin. It's an honor to be here. It's well known that paravalvular regurgitation after TAVI is associated with increased morbidity and mortality, and that aortic valve calcium plays an important role in its development. However, actually, we don't have a standardized methodology to quantify aortic valve calcium. So the purpose of our study was to evaluate the impact of aortic valve and the LVOT calcium on paravalvular regurgitation and on the need for balloon post-dilatation after TAVI using 3 different calcium detection thresholds on contrast-enhanced CT imaging.
And how did you do it, your study?
Well, we included in the study 131 patients that underwent TAVI and contrast-enhanced CT before the procedure. Calcium volume of aortic valve and LVOT were quantified using a dedicated software and 3 different calcium detection thresholds, one of 650 Hounsfield units, another one of 850, and the last one of 1050 Hounsfield units. After that, we compared the predictive value of different cutoffs, and we found that highest discriminatory value for paravalvular regurgitation and for balloon post-dilatation was observed for the 850 Hounsfield units threshold. After that, we searched for the best calcium volume cutoff, and we found that for paravalvular regurgitation, the best cutoff was that of 157 square millimeters, and for balloon post-dilatation, the best cutoff was that of 267 square millimeters.
And if you would summarize your results?
Well, the main conclusions of our research is that firstly, it's feasible to quantify aortic valve calcium on contrast-enhanced CT imaging, and secondly, that its predictive value depends on the calcium detection thresholds, and in our study, the best calcium detection threshold was that of 850 Hounsfield units. So I would say that based on these results, we should implement in the clinical practice the systematic assessment of aortic valve calcium in order to identify patients at an increased risk of paravalvular regurgitation that may require balloon post-dilatation.
And is there any further work to do in this research field?
Yes, I think the next step should be to perform any randomized clinical trials in order to assess what's the best strategy, what's the best valves to use in this kind of patients, these patients with a high calcium burden.
Yeah, it's going to be interesting to see how it all develops. Thank you so much for sharing this with us. Thanks.